At my 2-week post-op appointment, I mentioned some tightness in my calf. I chalked it up to the exercises I was doing while still wearing my immobilizing brace. 9 weeks later, I was in the ER with a DVT diagnosis. If you watched the first video expecting every complication to announce itself clearly, this one's the correction. This one took 9 weeks to become obvious, and I had a clue at week 2 that I talked myself out of. I need to share the same disclaimer as always. I'm not a doctor, and I'm not a PT. I'm a data guy with 2 torn quad tendons and a watch that never stopped logging my injuries and recovery. We're still in the right side quad tendon recovery, the same window as the last video. That one covered gait and strength. This one is narrower, the deep vein thrombosis that was diagnosed around week 11, but that I believe was forming for most of the 2 months before that. I'll walk through what the early clue looked like, what got missed and why, and what my resting heart rate data did and didn't catch along the way. Here's how it played out, and it's a longer story than a single diagnosis date suggests. At my 2-week post-op appointment, I reported some tenderness and tightness along my lower calf, and I attributed it to the exercises I was doing while still in an immobilizing brace. That was a reasonable read at the time. 2 weeks into a quad tendon recovery, your leg is doing a lot of things that feel unfamiliar. At my next appointment, that tenderness seemed to have resolved. So from the outside, it looked like a closed loop. I noticed something, mentioned it, and it went away. Except it hadn't gone away. The clot was almost certainly continuing to form the entire time. By about 10 weeks post-op, I started getting muscle twitching in my right hamstring, the kind that feels like a minor cramp. Then the calf itself started to change, and over the following days it went from noticeable to unmistakable. It got swollen and tight, like a sausage in its casing, warm to the touch and painful enough that I couldn't sleep. That's when I went to the emergency department, and I was diagnosed with DVT at approximately 11 weeks post-op. The treatment was standard: blood thinners, a compression sock on the affected leg, and a temporary change to how I slept, with my legs elevated to help with drainage. Of course, that last detail matters more than it sounds like it should, because it's the reason the next injury on this timeline happened at all. But that's a different video. The DVT is a known complication after lower extremity surgery. It's not common, but it's not exotic either. If you're heading into a procedure like this, it's worth knowing the symptom profile going in, and worth knowing that early symptoms can resolve on the surface, even while the underlying problem doesn't. Here's the resting heart rate data across that full window, from the 2-week tenderness through the 11-week diagnosis. Averaged across those 8 weeks, my resting heart rate ran about 2.8 beats per minute above my pre-surgery baseline. That's a real statistically significant consistent elevation, not noise, but it's not the dramatic story you might expect from a serious complication either. It's a quiet average, sustained across 2 months, not 1 day's signature of a clot. The clot was forming the whole time, hidden inside what looked, from the outside, like a normal post-surgical recovery. For scale, the 2 tendon ruptures produced acute shifts of 9.4 and 6.7 beats per minute, both concentrated in a couple of weeks. The DVT's elevation was smaller than either, and it was spread out over 2 months instead of spiking. There's also a small, interesting wrinkle right around when the twitching started. The number dips back toward baseline in week 10, then climbs again over the 2 weeks that follow, peaking just after the diagnosis. That pattern lines up with the symptom timeline, but when I tested it directly, it was not statistically significant. It's an interesting pattern to look at, but I can't say with confidence that it's real rather than noise. I have a theory for why the overall signal reads this small. Again, this is a theory, not a clinical claim. This whole window sits inside the normal post-surgical recovery curve, so an elevated number here is exactly what you would expect from healing alone. There's no clean way to pull the clot's specific contribution out of that. And once treatment started, the blood thinners would have limited how much additional strain the clot itself could put on my system, which caps how high the number could have climbed even after diagnosis. Either way, the honest answer is that this chart cannot tell the 2 stories apart. This is the part I want to be careful with, because it would be easy to walk away from this video with the wrong lesson. The lesson is not, my watch would have warned me. It didn't. I had a physical symptom at week 2 and reasoned my way past it, which is a very human thing to do, and also exactly the failure mode worth naming. The data are a retrospective explanation, and a mild one at that. A 2.8 beats per minute average, confounded with normal surgical healing, that I only pulled up after I already knew where to look. It was not, and would not have been, an early warning system I was watching in real time. Resting heart rate tracks systemic physiological load. That's useful information. But a clot forming in a calf vein is a localized vascular event, and there's no guarantee it produces enough systemic load to move a nightly average by a meaningful amount, especially early on. Small elevations are well within the kind of night-to-night noise that shows up for a dozen boring reasons. Bad sleep, a warm room, a stressful day at work. You get the picture. If I had been watching that number in real time during those 9 weeks, I likely would not have flagged it. The number was never the thing that should have caught this. The tenderness at week 2 was. The actual takeaway has nothing to do with a wearable. These are the standard symptoms worth knowing if you're post-surgery on a leg or otherwise at elevated clot risk. Tenderness or tightness that doesn't fully resolve. One leg swelling more than the other. Warmth or redness in the calf. And if it's serious, shortness of breath. That last one especially means call now, don't wait. I'd add one from experience, not from a symptom list. Don't let an early clue get explained away just because it's plausible. Thinking it's probably the exercises was a reasonable guess. It was also wrong. If something lingers or comes back, that's worth a call even if you already have a tidy explanation for it. None of this requires a chart to notice. It requires paying attention to your own leg and not being too quick to explain away what you find. If something looks or feels off during a post-surgical recovery, that gets a call to your doctor, regardless of what any wearable number is or isn't doing. The free resting heart rate tracker tracks the load signal this video is about, week-over-week trends, not acute medical events. The link is in the description and pinned comment. If this was useful, or even a little interesting, please subscribe to my channel. The next video is the strongest forward-looking signal in the entire data set, a run-up that showed up weeks before a diagnosis. That one's worth waiting for. This is not medical advice. This reflects my personal recovery experience and wearable data only. DVT is a serious medical condition. If you notice leg tenderness, swelling, warmth, redness, pain, new muscle twitching, or shortness of breath, especially after surgery, contact your physician promptly rather than waiting to see if a symptom resolves on its own or if a wearable metric changes. Always consult your physician or physical therapist about your own symptoms and risk factors.